Welcome to Chapter 48, Part 2, Soft Tissue Injuries. Let's talk about traumatic injury. Injuries to the soft tissues, muscles, ligaments, and tendons typically occurs during play or sports. Contusion. Damage to soft tissue, subcutaneous tissue, and muscle causes the escape of blood into tissues causing ecchymosis. That's the black and blue discoloration. It results in swelling, pain, and disability. A contusion often occurs as a result of a crush injury such as a child slamming their finger in a door. Dislocation. This is displacement of normal position of opposing bone ends or the bone ends to the socket. It occurs when force of stress on a ligament is sufficient to cause displacement. One of the most common forms in children is subluxation of the annular ligament, or in other words, a pulled elbow. In a majority of these cases, the child's arm is suddenly pulled longitudinally, or traction occurs at the wrist while the arm is fully extended and the forearm is pronated. So how can this happen? Think about a parent holding their child's hand and the child suddenly starts to fall. What is the parent's first reaction likely to be? Yep, it's to jerk the child up. This can result in a pulled elbow. Shoulder dislocations occur most in adolescence and are typically sports related. Hip dislocations are a concern due to the potential loss of blood supply to the head of the femur. Pain increases with active or passive movement of affected extremity. Usually occurs most commonly in children with Down syndrome. So sprain. This is trauma to a joint from a ligament, partially or completely torn or stretched by force, may be associated with damage to blood vessels, muscles, tendons, and nerves. Presence of joint laxity is an indicator of severity. Has a rapid onset of swelling with disability. The child will complain of hearing or feeling a pop. Strain. A microscopic tear to the musculotendinous unit is similar to a sprain. The area of injury will be swollen and painful to the touch, generally incurred over time. However, how quickly the symptoms develop indicate the severity of the injury. Let's look at therapeutic management. The first minutes to 12 hours are the most critical period for soft tissue injuries. You can use the acronym RICE and or ICES. You rest the injured part, you ice it immediately, maximum time of 30 minutes, compression with wet elastic bandage, elevation of the extremity, immobilization, and support. Could be used cast or splints, whatever is appropriate for the injury. This concludes Part 2 of Chapter 48.